Hey everybody, this is Tom Salemi. Welcome back to the Device Talks Weekly podcast. No doubt it's hot where you are, so you probably won't run as long as you normally do, or hopefully you won't do as many chores in the yard. So we have a slightly abbreviated episode of the Device Talks Weekly podcast for you, but it's highly entertaining and informative. Chris Newmarker is carrying the load today. He not only brought his Newmarker's Newsmakers, but he also interviews Tom O'Brien, who is the worldwide president of endomechanical at Ethicon. They talked about a few things, but really centered around its Echelon 3000 stapler. Really interesting conversation, one that I hadn't really given a lot of thought to when it comes to surgical tools, and we'll talk a bit about that later on. But we'll also review our Newmarker's Newsmakers. And before we get into all of that, I want to invite you to a webinar I'll be putting on Tuesday. It's not a Device Talks Tuesdays, although it is on Tuesday, but it's a very short discussion about what we'll be doing at Device Talks West. This promises to be an exceptional show. We will have presentations by a lot of supporting companies, including Abbott, Boston Scientific, Medtronic, Penumbra, Shockwave. We'll have speakers from Intuitive and Outset. You can find it all on devicetalks.com. I have more names coming your way. But we really wanted to just take 10 to 15 minutes on the webinar to talk about what the program looks like and how you can be involved. So I will have a link to the registration page on our podcast page. So you can go to devicetalks.com, find the page for this podcast, and I'll have the registration link there. Or I'll put it in the comments on LinkedIn if you're checking out my LinkedIn posts about the podcasts. Or heck, just reach out to me on LinkedIn or Twitter, or shoot me an email, tsalemi, T-S-A-L-E-M-I, at WTWH Media. Would be great to have you as part of the presentation. You can ask questions and hear what we're up to. It's going to be really, really great. So, all right, without any further delay, let's get this podcast started. But I do want to say this podcast is brought to you by our very own Device Talks West. Our meeting is happening on October 19th and 20th at the Santa Clara Convention Center. It's going to be an exceptional community meeting for the West Coast med tech community, and you should not miss it. Whether you're on the West Coast, East Coast, or Midwest, anywhere you are, you should be in Santa Clara on October 19th and 20th. Go to devicetalks.com for more information and to register. All right, you ready for this?
Ready.
Chris Newmarker, how are you, sir?
Doing well, Tom. Doing well.
Fantastic.
Cooler weather here in Minnesota, though I heard you're been boiling out in Boston, right?
Oh, it hasn't been so bad. You know, I think it's hot everywhere. I feel like every Zoom call I have has been a discussion about whether the temp has moved it up or down 10 degrees. So,
of course,
it's summer.
It's typical.
It's summer.
You know, half a year from now, we'll be complaining about, it's so cold.
You'll still be grilling in the wintertime, though, right? Because you grill outdoors during the winter.
Well, a little, No, I mean, winters. No, I'm not that hardcore up here. I'm not pulling the grill out in the winter time, though. I mean, I do see, especially like old guys around my neighborhood doing that. It's pretty good. Maybe I'll wait till I'm older. It's be a good retiree thing to do. I'm gonna grill out my steak, even though it's like 10 degrees outside or whatever.
I have a small deck on my house, smallish deck on my house, and we had the grill on it, which was very convenient, but I moved it off early this summer to make more room for just leisurely decking. And just going down the stairs, it's really cut my grill probably in half, like my grilling in half.
How tall is your deck? How tall? How high up?
So it's like 5 or 6 steps. I'm incredibly lazy, Chris. I'm not saying
this is like climbing, Chichen Itza or something,
It's not a hardship. Yeah. No. I just out of sight, out of mind. It's like, oh yeah, the grill
down there. I can use that. Right. That's good.
All right. So we have a lot going on today. We'll have go through our Newmarker's Newsmakers, and then you speak with Tom O'Brien from Ethicon about their new Echelon surgical stapler. Very good job with the interview, Chris Newmarker. You wouldn't think that something as seemingly mundane as a stapler would have so much complexity to it.
No, seriously. I mean, it was really, I say this was all with all honesty. I never thought that surgical tools were so
Yeah.
fascinating. It was actually yeah. It's a really good interview about like how I mean we talk about like some of these really cool gizmos like oh robots and stuff that delivers electrical charges to the heart. But yeah, I mean something. I mean it's something that people need. We need to have surgeries. We need to have laparoscopic surgeries, and it's actually very interesting how you can innovate something like that and like get some real results. So
Absolutely. And he had one of my more entertaining how you get into medtech industry things. We won't say anything. We'll tease it, but
oh yeah.
yeah, his path there made me chuckle. So, all right, Chris Newmarker, let us roll into this. We know why the people are here. They're here to hear the Newmarkers Newsmakers list. So what
That's
is?
right, the new markers news makers. Well, Tom, I mean, okay, to start out, I mean, it's
Oh, do I have to play the sad music? Are we?
yeah, play the
Oh no, the first one's not sad, right?
well, actually, it's interesting. So, we're in the middle of earnings seasons right now, and actually, there's a lot of grim, or I don't know, grim, but it's just kind of sad earnings reports right now. Companies taking a lot of medtech companies taking hits on their stocks, as they reduce guidance and miss the street. I mean, Edwards Life Sciences, for example, like had a tough day with their earnings report.
Mm-hmm.
But of all of those earnings stories, the ones that's doing the best on mass device actually had a little more of an optimistic tone to it. Probably just people are just looking for a little optimism. So we have Stryker. They did lower their EPS guidance for the year, but at the same time, they actually boosted their expected sales growth. They're expecting like 8 to 9% this year from a previous 6 to 8%. So, this is kind of like good news. I mean, like they're facing supply shortages. I mean, I think actually probably just to back up. I mean, that's probably the biggest theme we're hearing with all the earnings reports.
Yeah.
We're hearing about like supply chain problems, macroeconomic, troubles, inflation.
Yeah, BTIG said that Edwards' slowdown was attributed to, they chalked it up to slower recovery in the U.S., staffing challenges,
Yeah,
as well as
we've been
stiff
hearing that.
foreign currency headwinds. So some big macro stuff going on for sure.
Dollar is strong right now,
Yeah.
so that's causing so they can make it harder to sell overseas. So there's just like a host of things that people are working through economically. And in the general news, we've got the debate over the dreaded R word. So
Don't say it.
I'm not going to say
If
it.
I see one more LinkedIn article about whether we're in an R or not an R. But the Globe had an interesting article this week about ORs in Boston, the Boston Globe, just having to shut down because of lack of nurses, lack of staffing there. So I have to think that that's going to be impacting medtech down the line if other hospitals are experiencing the same problem. If fewer procedures are done, obviously fewer devices are sold.
Absolutely. I mean that's another thing we've been, hearing somewhat in the earnings reports is like people talking about, staffing shortages at hospitals, and it's just not ramping back up as quickly as they thought. I mean, people working in healthcare they've had a tough few years.
Mm-hmm.
It's not going to be easy to get things back to where they were with staffing before the pandemic. So we'll see how long it takes to get that back as well.
Sure.
And then there's all the issues around that. I mean, we had nurses doing little protesting, picketing around the Twin Cities like a few weeks ago. So a lot going on in that space.
Absolutely. And I'll plug the Medtronic Talks podcast that's coming up next week. I spoke with Dr. Laura Mowry. She's the new Senior Vice President, Chief Scientific Medical and Regulatory Officer at Medtronic. She was an interventional cardiologist until 2018, but we talked a bit about what companies like Medtronic can do to support hospitals and to sort of be partners in finding a solution going forward. So folks should check that out. All right. Well, good news, I guess, for Stryker.
Well, for Stryker, which happens to be the largest orthopedic device company in the world.
How do you know that, Chris Newmarker?
Funny thing, we have our annual Big 100 project, which is coming out in September, but I'm giving people a little early sneak peek and going through the annual reports for the largest ortho companies and ranking them by the revenue size of their businesses. So we have a nice list on Mass Device, the 10 largest orthopedic device companies in the world. We just posted it this week. You can find out what the 10 are, and we've got nice sections like updating on, how all these different companies are doing. So if you want to get a nice snapshot of where the largest companies in the ortho space and how they are doing, go to massdevice.com and check out 10 largest orthopedic device companies in the world.
Absolutely. No, it's a great account, and I guess we're revealing that Stryker is number one, and I was surprised by how much it is number one. So folks definitely want to check out these numbers. I thought they're very, very telling.
Yeah, I mean it's pretty amazing. I mean, and I remember it was kind of big news years ago, and Stryker was kind of like moving ahead of DePuy, in the rankings to become the largest, and still very much is so. And and it's kind of like some kind of new names on the list versus previous years of when we've done something like this as well, because we've had some interesting spin-offs going on. In fact, we got a spin-off coming up farther up in the in this new marker newsmakers list.
Absolutely. And just looking at the list, I see, and I won't say where they are, but DePuy Synthes, who we had at Device Talks Boston, Zimmer Biomet, who we should have at Device Talks West, is on the list as well. And of course, Medtronic, who we've got things going on with. So
huge spine business. Yeah.
Yeah. So, all right.
Very much so. Oh, they have to go to Mass Device now to read the rest of it. So.
Yeah, exactly. I didn't say where they are. People got to find that they can find out where they're placed on the list. But definitely. So the best way to go is just to
Mass check Device. Out 10 largest orthopedic device companies in the world on massdevice.com.
Yeah, we'll include a link to the article on the show notes as well. All right, Chris Newmarker. Cool. What is number 3 on the Newmarkers Newsmakers? What is number 3 on the Newmarkers
Newsmakers? We got number three. We've got prescription digital therapeutics company Pear Therapeutics. They're letting go of roughly 25 employees. It's about 9% of their workforce. They only started publicly trading last year. It's one of those slew of SPAC deals we saw. But looks like they're saying they want to narrow their near-term business focus and reduce workforce due to a phrase we're unfortunately hearing too much right now: macroeconomic environments. So there we go. We got some layoffs happening. So.
Well, that's unfortunate. This was from very
unfortunate.
You pulled this from the from their 8K.
Yep, exactly. Yeah, the 8K came down from them with the news. Based in Boston, like definitely one of the companies that we've kind of been following a lot, because they were one of the SPAC deals, went public, kind of in this really interesting digital therapeutics space, like kind of like this idea that maybe instead of pharmaceuticals or along with pharmaceuticals, you could have some really neat digital health offerings that could help people manage various conditions. So they're very active in that space.
All righty, let's roll on to number 2 on the Newmarkers Newsmakers, Chris.
Number 2 on the list, this is Dexcom, and one of the really like anticipated launches we're looking for here in the U.S. is the launch of Dexcom's G7. Smaller than their previous CGMs. Lower, nice lower profile, all kinds of innovations they've packaged into it, but it looks like we'll have to wait longer to see that, because they say that FDA gave them some feedback that they'd like some software tweaks on that. So we're like they're saying they're looking to see limited launch in the US later this year and a large commercial launch then next year. So so the big launch early next year is kind of what we're looking for now with the G7. So so that's kind of the news over there.
Well, it's unfortunate slowdown, but Dexcom's been white hot, so I guess a little cool water is not going to slow them down too much.
Yeah, it looks like the markets are digesting it pretty well, because they're we'll get it there eventually. We'll get that G7 out in the United States, and it's something that there's a lot of anticipation for it in the diabetes community.
All right, Chris Newmarker, big news at number 1. What is number 1 on the Newmarkers Newsmakers list?
That's right. Number 1 is that 3M is going to spin off their healthcare business by the end of 2023. So just add them to the list of these, like, I mean, this seems like we're just having like tons of spin-offs of medtech and healthcare businesses right now. I mean, GE Healthcare is going to become an independent company. We saw Johnson and Johnson spinning off their consumer business, and so we're going to have like this kind of new Johnson Johnson medtech that's like partnered with pharma, in that company. Then of course we had the creation of ZimVie with Zimmer Biomet spinning off its dental and spine business, BD spinning off its diabetes units, just all kinds of spin-offs. And now we're going to have like a 3M. 3M Healthcare is going to go independent as well. Lots of questions. I mean, who's going to run this new business? I mean, they have an interim president right now. Like, where the headquarters going to be? If they stay in Minnesota, they'll be one of the largest companies here in Minnesota, just even on their own. But times are changing.
And they had just the retirement of their healthcare leader, Moje Poole, right?
Just recently,
July 1st. So
as of July 1st, and then here they were, announcing this now, like near the end of July. So,
well, it's going to be interesting to see who leads that company and what it will ultimately become. It'd be nice to have another separate medtech player, someone who we can have at conferences and on podcasts, and hopefully report on great acquisitions and growth. So good for 3M Health.
Yeah, they're arguing that the 3M management are saying that this spinoff's going to give them more independence to work on innovations. So really exciting. And I mean, this company, just on its own, brings in billions of dollars of revenue a year. So I mean, they're going to be one of the largest medical device companies in the world. I mean, they had over 2 billion sales just for the second quarter this year.
Very cool.
Yeah.
All right. Well, great job, Chris Newmarker, and you're carrying this episode because you've got this upcoming interview with Tom O'Brien.
Yep.
Worldwide president of endomechanical at Ethicon. So let's get that started.
Let's hear what he had to say. So hi there. This is Chris Newmarker. I'm executive editor of Mass Device and Medical Design Outsourcing. Today on Device Talks Weekly, we're discussing surgical devices and tools. Johnson & Johnson's Ethicon is one of the largest surgical device companies in the world. In June, they launched their Echelon 3000 stapler. It's digitally enabled and meant to provide surgeons with simple, one-handed power articulations. Think fewer surgical complications, which is no small matter. To talk about the Echelon 3000 and much more, we've got Tom O'Brien with us. He's the worldwide president of endomechanical at Ethicon. Tom, welcome to Device Talks Weekly.
Thank you, Chris. I'm glad to be here.
So I'm always interested to hear how people got into the medical device industry. I mean, I saw on your LinkedIn page, you're in Cincinnati, where Ethicon has a huge presence. You started out, though, at another major company that's based in Cincinnati, Procter & Gamble. I mean, how did you go from a company that's known for selling, soap to, and cleaning products, to surgical devices? I'm really interested to find out.
So it's actually kind of a funny story. So when I was doing my graduate work, I got a chance to work on the design of an intravenous pump. And I thought it was fabulous. So I had wanted to work in healthcare. And as I was interviewing for roles, I talked with Procter & Gamble, who said, "Oh, we're very interested in healthcare. They have a health and beauty section." I said, "Would I be able to work in healthcare?" And they said, "Yeah." So I get there and I'm working on shampoo. And I said,
"Oh, wow."
So I said, "Well," I said, "this is really interesting, but I was interested in healthcare." And they said, "Health, beauty, it's the same thing." But I loved it. It was a fabulous. I loved my experience at Procter & Gamble. And then after going through my career, I had a chance to make a decision about, after a software startup that I was involved in, to come back to a larger company. And that's where I made the choice to go to Johnson & Johnson, specifically for that reason, this ongoing passion I had about trying to make a difference in people's lives.
That's fantastic. That's a great story. I love it. Shampoo, but now here you are working on surgical tools. So I mean, like, fast forwarding today. I mean, okay, so you're worldwide president of endomechanical at Ethicon. What are the top areas where you see Ethicon right now and investing in innovation? I mean, what has you the most excited right now?
Well, within our endomechanical business, what we're really excited about making a difference. We're very excited about making a difference in surgical complications. And I'll come back to that in a second as to why. And then we're also excited about trying to make a difference in really difficult disease states like cancer. But let me come back to complications, because when I first joined the business, surgical complications, they're known and it was on our radar screen. But for most of us, we thought of surgical complications as being relatively rare and
It's
not
interesting.
often, relatively rare and not all that influenced by devices. And so we decided actually we wanted to find out the answer of how significant a problem were they. And if you look at clinical trials are kind of a rough, are not a great way to really understand it because they're so well controlled. But about the time, about 6 or 7 years ago, we started exploring some of these really large data sets. And in the US, there's the premier data set that covers about 40% of hospitals. And so we mined that data set to really understand what was the true extent of complications. And then we filtered it to understand, of those complications, which ones could you really attribute to the surgery process and perhaps even the devices. And what surprised us was the complications were not as rare as we thought. And the overall health burden of them, just in the US alone, was $2 to $3 billion.
Wow.
So that became our rallying cry. We said, with our devices, in endomechanical, we are largely, you think about the devices that make up endomechanical. There's access devices and ligation devices.
Right.
But 2/3 of it is really stapling. And stapling is part of the most critical step in cancer surgeries, bariatric surgeries. That's where, if you have the greatest opportunity to deliver clinical benefit, but you also are most likely, and that's the step in the procedure that's most likely to cause complications. So we put our attention against that and said, how can we make a difference? And once we understood how big the challenge was, the question that we faced was, what's the cause? It's great that I've discovered that surgical complications are endemic, but we needed to understand why. And two themes emerged from the work that we did. One theme was access-related injuries. And that was sort of not surprising that, particularly when you're in a procedure and you're trying to address a tumor that may be lodged between critical structures, trying to navigate around with your devices to get it, it's not uncommon to injure other tissue. That was understood. The second was less understood, is tissue condition. And one of the things that we learn as you develop devices is devices, when they're developed with benchtop testing and preclinical testing. Largely the preclinical testing that we do before we bring things to market is usually young, healthy, porcine or other models that we use, but it's young, healthy tissue. The tissue in these cancer cases is fibrotic, it's emphysemic, it's irradiated, it's highly friable. It's nothing like the tissue that we generally would use for development purposes. And we did studies on the tissue to understand its elasticity, to understand how it behaved relative to actually quantify the difference. And they're huge.
This is like fibrous damage.
Yeah.
Tissue,
So it's something you put stress on friable tissue, it's going to tear much more easily. And so that was a whole series, this area of compromised tissue, and the idea that compromised tissue needed to be handled differently. There were accommodations we needed to make for compromised tissue if we really wanted to make a difference in complications. And that's where a lot of our attention has been. So going back to your original question is, what is our focus? What are we eager to make a difference in? It's to better understand compromised tissue in lung cases, colorectal cases, solid organ cases, in any of these cases, in bariatric cases, in GI cases, understanding compromised tissue and the role that it plays and how it needs to be handled and how it needs to be handled differently in each of those cases.
I mean, so how can you, as the producer of the tools, I mean, I'm sure there's a chunk of this is just like, the skill of the surgeon and, them being aware of, the condition of this tissue, but how is you as the maker of the tools that they're using, how can you help them better handle this compromised tissue so, that there aren't, complications down the road?
Well, it has to do with so the mechanism that bleeding and leak complications can occur by are micro tearing. And that can happen within the jaws of devices as staples being fired. So what we will do is understand how we need to tailor the design of an endocutter, how the staple formation might need to occur, the compressive load on it, the amount of lateral tension. all play a role in whether that tissue would be more susceptible than for a complication occurring. And that's where our design work's going. Is so there's a lot of work that's being done on the benchtop and preclinically, and even with modeling to understand how we reduce those stresses within tissue. And overall, one way to think about it is when you're handling something that's really delicate, you generally try to stabilize it. You try to widen, if you're holding it with your hands, you try to spread out the load as much as possible. You try not to put lateral tension on it. You try not to yank on it one way or the other. Those are all the same principles we're following, except we're trying to do it with tissue. Yeah. We're trying to spread the load out. We're trying to when we added our gripping surface technology, the gripping surface was simply designed to prevent lateral tissue flow. As you're compressing the tissue, it's going to want to spread and flow away from the device. By putting the gripping surface, then you're stabilizing, you're holding it in place, so that as you fire the device, you're less likely to see that motion where the tissue starts flowing away from the knife and away from the center of the device.
That's amazing. I mean, when you're designing that gripper, what you're using to stapler, what do you have to do to prevent it from doing that, from spraying it out?
Well, the case of that is we added a series of protrusions on the cartridge of the device. So what they do is they essentially grip the surface of the tissue.
Oh, that's great. It kind of holds it in place.
Kind of holds it in place, yeah. It holds it in place from moving so that you can make the cut. And as the staples are being formed.
It's interesting. I'm kind of picturing if I had two pieces of construction paper, I could just stick them in a stapler and boom, staple. But if I had two pieces of Kleenex, I'd be wanting to, make sure I held them in place and whatnot if I didn't want to tear them up trying to staple them together.
That's exactly right.
That's fascinating. So you make sure you have some grippers in there and that kind of help hold them in place, while the stapling. How old is that innovation? How long has that been around?
Well, that was one of the first innovations we came up with once we understood the challenges of compromised tissue. And that innovation is now about 7 years old. But we continue to make advances. So some of our more recent innovations have been around how do we even the compressive field. So when you're stapling, you want even compression across the entire staple line. So we have innovations that are designed to do that. We've explored and have in the market now different staple forms. So the typical staple form that people think about looks like a B. So the legs come up, they fold over, and it makes a B.
Oh, wow. Okay.
We have staple forms now that we're employing, particularly on our circular device that was just launched, that fold over more gently. So they flatten over the tissue and they spread the load instead of just in the pockets where the B's are formed. They spread it more evenly across the entire size of the staple. And we call that a 3D staple form because it's three-dimensional, it's flatter. And then what we do is instead of putting the legs exactly in the same plane as the crown of the staple, we splay them off to the side. So the load is spread both longitudinally and laterally. So it's more evenly spread. So picture as you fold your fingers over, if you're trying to make a staple shape, instead of folding them so that they touch, they fold flat, but they fold off to the side from each other. So
okay.
It's a different staple form, and we've employed that staple form now in several. We started in our mechanical devices, in our linear cutters, and then most recently in our circular stapler. In the circular stapler, it was part of a solution to try to minimize anastomonic leaks, which are one of the most problematic complications that can occur in surgery, because it's a complication that will send a patient, usually a colorectal cancer patient, will send them into the ICU and send them into resurgery if they wind up getting an anastomonic leak, which occurs usually a day or two after surgery. Up until very recently, the typical percentage of cases that result in anastomonic leaks was between 7 and 10%. In some cases, it can even be higher. So it's a fairly frequent complication, and it can be a devastating complication. It's also a complication that about 15% of the people who get it will die from it. So we looked at that and said, can we make a difference? And the thinking was, well, that's a complication that has so many different factors that are involved in it. It's going to be incredibly difficult to make a meaningful difference. And then it'll be even more difficult to be able to prove it later on. But we said, well, let's give it a shot. I mean, if a complication is severe that it can cause mortality and have a devastating impact on patients' lives, we said maybe we can make a difference. So what we did is we employed those principles, even compression, stabilizing tissue, using that new staple form to spread the load more evenly, the gripping surface to hold the tissue in place so that it's not likely to pull or stretch or cause micro tears. And then we added powered firing so that there was no lateral tension. And so when you fire a device, sometimes these things can be pretty hard to fire. And so it's
Yeah.
very difficult to keep the tips steady. But when you have a powered firing, you can hold the tip very steady. So we employ all those innovations together in one circular device.
Tell me a little bit more about the firing. I mean, with these types of devices, is it like pneumatic power, or how do they work?
Well, there's two ways that they do. The manual devices, particularly with endocutters, are usually there's an arm, a trigger that you have to usually stroke between 1 and 4 times, depending on the device itself, to get mechanical leverage, to be able to get the jaw to close, the knife to cut across, and then all the staples to be formed. So you get it here. If you're forming 80 staples, that's a lot of energy. So in some of those devices, there'll be multiple strokes in a manual device. So you might have to squeeze it several times in order to fire it. We had an experiment that we would do is we'd ask surgeons to actually fire the device and see how steady they could hold the tip of the device while they're firing this thing, stroking it, 3 or 4 times.
Yeah.
And it's very difficult to do. It creates a squiggle pattern when they do it. It's much harder than you think. And then when we introduced the powered device, we said, okay, now see how steady you can hold the tip. And as you can imagine, if you find a power device and it automatically fires and sends the knife down, forms all the staples, you can keep the tip of the device within a half a centimeter.
Oh, wow.
Yeah. And what's important about that is when the device tip is moving, you're clamped on the tissue. So you're going to fire the place that you want. But what's going to happen is you're going to put stress on the tissue because you'll have lateral stress. And one of the worst things you can do with the staple line is put lateral stress on it while you're firing.
Oh, wow. So just like getting a powered device in, and so it's basically like electronic motors to
so
fire
it's a battery powered motor that fires that controls the firing of the device. And so each one of those things, the powered firing stabilizes it from lateral tissue movement. Precompression forces the fluid out of the tissue so that when the firing occurs, that the stress level that's created when the jaws come close together and the staples are fired is reduced and more uniform. The gripping surface holds the tissue within the jaws of the device from flowing so that there's not internal stress that's created. And then ultimately the staple forms themselves can spread the load more evenly. And each one of those things contributes to this idea of stabilizing tissue and more evenly treating the tissue during the firing sequence.
Kind of like moving on, then we've got the Echelon 3000, which just recently launched here in the US, and this is kind of like the next generation device. I mean, what specifically then are the new benefits that you've added on, with this iteration of it?
Let's see. So when I was talking about circular, ultimately the circular device was all about approaching the types of tissue that we had and improving the firing ability. With the Echelon 3000 device, our attention was to the first of those themes, was we realized that access-related injuries and access can be one of the most important ways that you can make a difference in complications. So with the design of that device, we're looking at how we can improve access in 3 major procedures. One of them was the lung cancer procedure, so a thoracic procedure, reaching over and doing a medial segmentectomy. And what you need there is you need a wide jaw aperture to reach over and to grasp the thick medial lung. You needed to have articulation that could be where you could articulate the device within the thoracic cavity without pressing it against other tissue and be able to get it precisely where you wanted. You need a sharp angle to be able to make sure that you can get the medial section properly. And then when you fire the device, you need a nice, smooth, powered firing. And so that's what we did. We brought together with this device. So using these different cases, we increased the jaw aperture, so you can open the jaw wider to get around tissue. We increased the angle of articulation so that, I gave you an example in lung, but then the other case that we were looking at was colorectal case. When you're deep in the pelvic area and you need to be able to get as close to a right angle as you can get. This is the sharpest angle that you can get on any stapler now. And the jaw aperture is the widest that you can get. So it was all about improving the ability of getting the jaw and the jaw aperture around the tissue that you need to without impinging on other tissue.
It sounds like a lot of human factors were involved in this.
That's a lot of what we do. So the weight balance of the device, the articulation angle, even things like we use some of the intelligence of the device to be able to allow the articulation controls to be used whether the device is upside down or right side up, so that the orientation, it corrects for the orientation. So the surgeon, there's no confusion as to which way the device is going to articulate when you press the buttons. All thinking about what's the surgeon intend to do with the device when they're deep in the thoracic cavity or deep in the pelvic area, or if they're doing a sleeve gastrectomy as part of a bariatric procedure, they're in the chest cavity trying to get a precise angle as they form the sleeve.
I'm thinking like, when you're creating this, we got hit with, the COVID pandemic, so I'm thinking it would have been hard to get into the operating rooms to watch them in person to, get an idea of what they were doing. How did you work around that?
Well, the development and the understanding of these procedures happens over a many-year time frame. So we build upon the knowledge we have.
So we were years before the pandemic.
So we were in cases before COVID came out. And so a lot of the design principles and a lot of the work was done was before COVID. But you're absolutely right, is getting into cases during COVID was really challenging. We were able to do it, but not to the extent that we normally were. And so it was a good thing that a lot of the early development work was done before COVID.
Yeah, going forward, do you think you're getting more access again, or we've talked to companies that have started to use more video conferencing and type of things in operating rooms?
I think that there is an essential step of being in the operating room when you're doing visits that are for R&D and product development.
Yeah.
I think there are some things you can make up. You can do interviews, and you can do interviews that are helpful. You can bring surgeons in for labs, and you can have discussions with them and review the surgical steps there. That can certainly help. But it's tough to substitute for the real clinical situations that you face in the OR.
Yeah, just being there and seeing what they're doing.
Yeah, because the types of situations, the complicate, you don't get, if you aren't in surgery enough, you don't get to see some of the complications occur. And that's really where some of the greatest insights can come in, where you see a potential complication emerging. How does the surgeon accommodate for it? What might we have been able to do that could have improved it? It's tough to substitute that. So I think in the long run is, yes, we're going to bring in some of these tools that we learned during COVID, but it's never going to be a complete substitute for actually being in the OR and getting a sense for what the real challenges are with some of these particularly tough cases.
We were talking about smoothing out power behind the Echelon 3000. What went into that?
Well, smoothing out I think one of the most important challenges is when you're going to apply power to the device, it has to be incredibly controlled. And when your device is all built around the idea of precision, you need to be able to apply power so that you can adjust the articulation angle, adjust the firing as you need to. But particularly around articulation angles, you need to be able to stop it. And then when you switch into the mode of firing the device, to be able to lock the jaw in place or hold it in place so that it doesn't tend to move. And that was a particularly tough challenge, because mechanisms, particularly our articulation mechanisms, will tend to want to straighten out. And you can see that with other devices in the market, where when you fire them, they'll tend to try to straighten themselves out. Our device, we were very conscious of saying those articulation angles that are used in these cases, the surgeon's choosing them for a reason. And when they go to fire the device, we want to give them both the control over the firing and make sure that their articulation they've chosen, that articulation angle, is held precisely. Because sometimes, and I'll have bariatric surgeons tell me this, is the difference of a degree or two, or the placement of that line that they're doing as they're transecting the stomach, can be the difference between a really successful surgery where the patient has great weight loss and success, to a procedure where maybe they're not getting as good a weight loss, or maybe they're getting reflux afterwards. So we really tried to give as much precision and control back to the surgeon.
I'm thinking of this Echelon 3000 device. How long is this thing?
It is ergonomically, it's from a size standpoint, the same size as our current device. So that was the other goal
Wow.
we had is as we added capability to the device, we didn't want to burden it with excess weight or excess size because the weight balance and the size are really important. And the other thing that we're learning over and over again is that the composition of our populations of surgeons is changing. Relative to just a few years ago, there are far more female surgeons than there used to be. And devices need to be designed for people who have hand sizes of all different hand sizes and be able to, we have to be able to control the devices and be able to get that precision regardless of whether you're a size 6 or whether you're a size 9.
Yeah. That's fascinating. Yeah. So, I mean, how much of a challenge has that been in the past for women surgeons that the devices were more built for like big hand, strong arm guys, basically?
Well, originally we made a shift probably close to 10 years ago where we started designing for a much wider range of hand sizes. But
That's great.
What I love about our surgeon populations, and whether it's female surgeons or surgeons over in Asia, is fortunately they've been very vocal with us. I mean, they'll tell us immediately if we've got a device that is too difficult to fire, too difficult to manipulate. And we take that very seriously. We have a terrific human factors design group that is constantly working with surgeons and surgeons who have different hand sizes, different size overall, so that when our device is used, whether it's used by a really large male or a smaller female, that they can get every bit of the capability and benefit of the device, and it's just as easy to use for either individual.
That's really awesome. It just plays into there's just been this shift, whether it's like clinical trials or design or whatnot, just to make sure that we have devices that aren't just built, for basically for white guys like us, and for the whole population, everybody.
Yeah. The circular staple was the notoriously most difficult device to fire across the array of stapling devices. And there was an anecdote that I would generally hear is that, usually when it comes to the step where they have to do the anastomosis in a colorectal case, they would typically go find the largest person they could find. They'd flag them down in the hallway if they needed to actually fire the device because
my goodness,
it's so difficult to give both. You needed the hand span to grasp the handle, and then the force that's required to squeeze and close the device is the highest among any of the devices. So when we were able to bring the Echelon circular device to market, it made a huge difference. Also, it made that device accessible to everyone.
That's awesome. That's just great. And it almost plays into too. I mean, one of the big questions I had coming to this interview was, okay, so we posted an article about the Echelon 3000 and it got page views on mass device that we'd usually get for something that was like a robot or a heart pump. And, I just feel like talking with you today that I think it got the attention because there's just such an attention here to reducing these complications and saving lives, frankly. I mean, people could die if we have too many of these complications.
That's our mission. What we really view as success is if we're able to bring a device to market. And one of the things we do with particularly every stapling device that we bring to market, we now either put them in a clinical trial or we gather real world evidence, whichever is more appropriate for the case. But we're always validating to make sure that that hypothesis that we had initially, that we could make a difference in complications, we're actually doing it. And for us, that is the most important measure of success, is did we bring a device to market which has been able to make a difference in the health burden, make a difference in the current standard of care. And there is nothing more rewarding than that because these cases are cancer cases that people are involved in. They're bariatric cases. They're really serious operations where we can make a difference for people.
So before we wrap up, what's next? What has you most excited in the space, going forward?
There is so much more that we can do in the area of compromised tissue and organ-specific tissue. We are just scratching the surface now, as I mentioned, that we've been developing new staple forms, new staple patterns, and things like that. That is just scratching the surface of how we can make a difference in the way our device, and particularly the tips of the end effectors of our device, interact with tissue. That's where the action occurs. And when we make a difference there, that technology can be redeployed in robotic settings, it can be redeployed in laparoscopic settings, and even in open surgery settings. And that knowledge, in the same way that we took the gripping surface and we redeployed that across multiple modalities, these next generation of staple formations, materials, and so on that we're using will find their way across all procedures. I think you'll see that we'll follow those with clinical trials, and we'll show that we can continue making a difference in that $2 to $3 billion health burden associated with complications.
Yeah, that's fantastic. Well, Tom, thanks for taking time with us today. This was really fascinating stuff.
Well, thank you. I enjoyed it.
Yeah, great to have you on.
Thank you.
All right, Chris Newmarker, let's get this weekend started.
Yeah. Woo! Here we go. All right. So you can find me on LinkedIn.
Where can folks find you on social media, Chris?
Yes, it's good. You can find me on LinkedIn, Chris Newmarker, like a Newmarker. You can find me on Twitter @Newmarker. Always happy to catch up with people.
You're not on the gram?
No, I
posted a video of a bird tweeting.
Oh, wow.
That's getting a lot of attention.
Exciting.
Yeah. Just keeps every time. It's evergreen. It's just every time we open it up, someone else is like my bird tweeting video. It's up to, it's only 30 or so, but Instagram's weird. Anyway, I am on Twitter @MedTechTom. I am on LinkedIn, Tom Salemi. And of course, you can, what can they do to the podcast, Chris?
Like, follow, subscribe.
Absolutely. Like, follow, and or subscribe to the Device Talks Podcast Network. You will get future episodes of the Device Talk Weekly podcast. You'll get future episodes of the Stryker Talks podcast, future episodes of the Intuitive Talks podcast. And of course, you can also subscribe to Medtronic Talks, and you'll get future episodes and be able to find past episodes of all those podcasts. All will be sent directly to your listening device.
We have a wealth of multimedia content.
It's crazy. And you can find them on...
like a smorgasbord.
It is. It is a podcast buffet. Just put out the tray and just grab a green Jell-O and a yellow Jell-O and a red Jell-O. They're all there. We got all the Jell-Os. Every
Do they have those little chicken drummy things there? Like that's
we can get chicken drummies if you want.
All right,
that'll get you in the buffet. But you can also
go Ponderosa.
You can also find a good sizzler too. You can find what's sizzler buffet. Anyway, DeviceTalks.com has these all as well, and the individual company websites usually have them. Medtronic definitely has Medtronic Talks featured prominently, and Stryker Talks. Stryker has it up on their site as well. So that is a wrap. Once again, you can register to listen to my presentation about the upcoming Device Talks West meeting. I'll be giving it live on Tuesday at 2 p.m., but you can also watch it on demand. So I'll put a link in the podcast notes if you'd like to check that out to understand what we're doing there. It's going to be an exciting program. We'll have many great companies that I listed at the top. We'll be presenting and participating, including more that I'm not quite ready to announce yet, but hopefully will be in the next couple of weeks. So please do check it out and plan to join us as a sponsor or attendee at Device Talks West, October 19th and 20th at the Santa Clara Convention Center.
Got to be there or be square.
Absolutely. Do not be square. Speaking of birds tweeting, I just heard a bird tweeting in your background.
I think that's a cardinal. I got a wealth of birds.
Get a video of it, Chris.
The cardinal is really happy.
Get a video of that cardinal tweeting. You'll blow up.
The cardinal is excited to be a Device Talks West.
That's a wrap, folks. Tune in next week.
We have falcons in my neighborhood, Tom. Hopefully the falcon doesn't get the cardinal.
Tune in next week. Right. We'll have another great episode of the Device Talks Weekly podcast waiting for you.
Take care, everybody. Have a great summer. Look at that. That cardinal's really going.
He's really going.